Have you ever forgotten a simple name or where you left your keys? It might seem normal, but imagine this forgetfulness reaching a point where you can't recognize the people you love most or remember how to do simple tasks like getting dressed. This is the reality for those living with Alzheimer's, a disease that slowly takes away their memories and lives. What is Alzheimer's? Alzheimer's disease is a progressive brain disorder that gradually destroys a person's memory and mental abilities. It's most common in people over 65, but it can also occur in younger individuals, which is called early onset Alzheimer's. In fact, Alzheimer's is the most common type of dementia. Dementia is a general term for the decline of mental abilities that interferes with daily life. The disease is named after a German doctor, Alois Alzheimer, who first described it in 1906. Key symptoms of Alzheimer's. Alzheimer's symptoms usually start slowly and worsen over time. Here are the most common signs. Memory loss. A person might lose track of their belongings, forget the names of loved ones, or even struggle with basic tasks like cooking. Disorientation. They might get lost in familiar places like their own neighborhood. Difficulty focusing. They may find it hard to remember appointments or multitask. Changes in personality. Someone who was always cheerful might become irritable or moody. Language problems. They may forget simple words or use unusual phrases. What happens in the brain? In the brains of people with Alzheimer's, abnormal proteins begin to build up. These proteins, called amyloid and tau, block the brain cells and disrupt communication between them. As these brain cells die, areas like the hippocampus, which is crucial for memory, begin to shrink. Over time, the brain physically shrinks and the person gradually loses their abilities. Risk factors for Alzheimer's. Some risk factors for Alzheimer's are beyond our control, but there are things we can manage to reduce the risk. Here are the main risk factors. Age. This is the biggest risk factor. About 1 in 10 people over 65 have Alzheimer's. Genetics. If someone in your family has had the disease, your chances of developing it are higher. Lifestyle. Poor diet, smoking, and lack of exercise can increase the risk. Underlying health issues. Conditions like diabetes and high blood pressure can also contribute. Studies show that mentally stimulating activities, like solving puzzles or learning a new language, can reduce the risk. Treatment or prevention. Unfortunately, there is no cure for Alzheimer's yet, but researchers are working hard to find one. In the meantime, you can reduce your risk by adopting a healthy lifestyle. Exercise regularly. Even daily walks can make a difference. Eat a healthy diet. The Mediterranean diet, rich in fruits, vegetables, and fish, is particularly beneficial. Stay mentally active. Reading, playing games, or learning a new skill can help keep your brain sharp. Get enough sleep. Poor sleep can increase the risk of developing Alzheimer's. Research shows that having strong social connections, like spending time with family and friends, can help keep your brain healthy. Alzheimer's isn't just a disease, it's a challenge that impacts entire families. Remember, every step you take to keep your brain healthy is worth it. Now, tell us, what do you do to boost your memory and brain health? Share your thoughts in the comments.